Have you ever stared at a routine blood test report and just felt like you were reading a completely foreign language?
Oh, absolutely.
Right. You're looking at this sheet of paper or, your patient portal, and it's just a wall of complex, multi-syllable words that feel totally impenetrable.
Yeah, it's intimidating for a lot of people.
It really is. But what if I told you that you aren't just looking at medical jargon? When you read those charts, you are actually staring at a 2,500-year-old linguistic fossil.
It's true. It really is a fossil hiding in plain sight. I mean, we look at a modern lab report and naturally assume, like, the language was invented in some sterile, high-tech research facility maybe 5 or 10 years ago.
Yeah, like some boredom of scientists just made it up.
Exactly. But the roots of those words are ancient. They carry thousands of years of medical history and, well, a lot of trial and error.
And that is our mission for this deep dive. Today, we are going to crack the code of the medical combining forms hemo and hemato. Our sources for this deep dive include medical etymology texts, historical clinical records going all the way back to ancient Greece, and modern hematology papers.
It's a really rich set of sources.
It is, and by understanding just these two little roots from those sources, you are going to unlock hundreds of complex medical terms. We're exploring the ancient Greek origins, a surprising grammatical rule that separates them, some truly massive historical blunders, and how this exact vocabulary powers modern diagnoses today. Basically, we're going from ancient Greek humors all the way to modern hematology.
And it's a fascinating journey primarily because once you understand the architecture of these words, a trip to the doctor's office becomes significantly less intimidating. You transition from being, a passive recipient of confusing information to someone who actually speaks the language of their own health.
Okay, so let's unpack this. Because to decode the medical jargon on our charts, we first have to clear up what seems to be like the most common point of confusion for students and patients alike. Why are there two different spellings for the exact same thing?
Right, the classic question.
Yeah. We have hemo, H-E-M-O, and hemato, H-E-M-A-T-O. I've been thinking about this, and is the difference here just like the English rule of using a before a consonant and an and before a vowel, like, a doctor versus an apple?
Your analogy captures the mechanism perfectly. It is a purely orthographic or spelling-based rule. In linguistics, we call it a splitting rule, and it's designed entirely to prevent an awkward vowel collision in the middle of a word.
So it isn't based on biology at all.
Not at all.
It's literally just about making the word easier to say out loud without tripping over your own tongue.
That's the entire secret. Hemo is the short form. You use it when the next part of the word, the suffix, begins with a consonant. So think of words like hemoglobin or hemostasis. The consonant flows smoothly right after the O. But hemato is the long form, and you use it when the next part of the word begins with a vowel. Think of hematology, hematoma, or hematuria. If you tried to attach a vowel initial suffix directly to just him, it would sound incredibly clunky.
Hemology. Yeah, that sounds like you're choking on the word.
Exactly.
But that still leaves the question, why at? I mean, if they just needed a buffer, why not insert an S or an N? Where does that specific extra syllable come from?
Well, to understand the why behind that specific syllable, we have to go all the way back to ancient Greece. Both of these forms trace back to the Greek noun for blood, which is homa.
Humana.
Right. And in Greek grammar, words physically change their endings based on their grammatical role in a sentence. The genitive stem of haima, which is the form you use to show possession, like saying of the blood, is hematos.
Oh, wow. So that extra at in hemato isn't some random buffer someone made up in a laboratory to make things sound pretty.
No, it's a fossilized grammatical case baked directly into English medical vocabulary. It has been preserved for millennia. Which brings us to a major misconception we really need to debunk right out of the gate.
Get to that.
People often assume that because there are two distinct spellings, hemo and hemato must mean slightly different things.
Like maybe one refers to red blood cells and the other's for blood plasma.
Right, exactly. But that is completely false. They mean the exact same thing. Memorizing them as separate words with separate definitions is a total waste of effort. You just need to remember the splitting rule.
The irony there is almost funny. I mean, the linguistic root has been absolutely frozen for 2,500 years. This spelling hasn't budged at all. But surely the science hasn't stayed frozen. The word is the same, But the actual medical reality of what that word describes has to be radically different, right?
Yeah, what's fascinating here is that the word remained perfectly stable, but the conceptual content, what doctors actually think blood is and what it does inside the body, shifted entirely. Today, we know blood is a functional connective tissue. We define it by microscopy and biochemistry. But if we go back to when these words were coined, say back to Homer or the Hippocratic corpus in the 5th and 4th centuries BCE,
They didn't exactly have microscopes back then.
no, they had no concept of cells or oxygen transport whatsoever.
So if they didn't know about cells, what did they think they were looking at when someone bled? And more importantly, what were the real-world consequences of that belief?
They believed blood was a humor. This was the foundation of humoral theory, which the physician Galen really systematized in the 2nd century CE.
For humors, right?
Yes. The prevailing idea was that human health depended on maintaining a perfect internal balance of 4 cardinal fluids, or humors: blood, phlegm, yellow bile, and black bile.
And blood was essentially like the star of the show in that framework.
It really was. It was the sanguine humor. It was associated with warmth, optimism, vigor. It wasn't seen as just a biological transport fluid. It was a substance literally infused with moral and temperamental qualities.
Okay, but if this humoral framework dominated Western medicine for basically 1,500 years without any rigorous science to back it up, the treatments must have been disastrous. I mean, if you think a patient's humors are out of balance, your immediate instinct is going to be to try and force them back into balance.
Which almost always meant removing whatever they thought was in excess. And this leads us to the deeply lethal legacy of humoral theory bloodletting,
Wow, yeah.
or, phlebotomy as a cure. For over 2 millennia, physicians deliberately drained blood from sick patients to rebalance these humors.
I know this was standard practice, but like, how far did they actually take it?
Well, the most famous failure of this theoretical framework in our sources is the death of George Washington.
Oh, really?
Yeah. In December 1799, he fell ill with a severe throat condition, which modern historians believe was likely acute epiglottitis, so a sudden swelling of the windpipe. His physicians, following the absolute best medical science of their day, treated him with intense bloodletting to remove the bad humors causing the inflammation. Over the course of about 10 hours, they drained an estimated 5 to 9 pints of his blood.
Wait, back up. 9 pints.
Up to 9 pints, yes.
Physically, how does a human body even function losing that much fluid all at once?
It doesn't. The average adult human body only contains about 10 to 12 pints of blood in total.
Oh my God.
Yeah, by draining up to 9 pints, they removed roughly 40 to 80% of his total blood volume.
That is insane.
At that level of rapid volume loss, the body enters severe hemorrhagic shock. Blood pressure plummets, organs are deprived of oxygen, and the heart simply cannot pump enough fluid to keep the brain alive. It almost certainly hastened his death.
I mean, that isn't a medical treatment. That is a clinical exsanguination. And they did it thinking they were saving his life.
Because the theoretical framework of humoral balance demanded it, and it hadn't yet been subjected to controlled comparative testing.
That is just chilling. But to play devil's advocate, we obviously don't drain half a person's blood to cure a sore throat today. We're past that, right?
We don't practice humoral bloodletting, no. But if we connect this to the bigger picture, the sources point out a modern-day parallel that is sparking intense debate in modern hospitals. It's a condition called iatrogenic anemia.
Iatrogenic meaning an illness caused by the medical treatment itself.
Yes. Today, in intensive care units, patients have their blood drawn constantly for diagnostic lab testing. We are testing for everything, all the time. But studies have shown that these routine phlebotomies, just the diagnostic draws, can remove enough blood volume over a long hospital stay to meaningfully contribute to anemia in the patient.
You're kidding. So the very act of testing their blood to figure out what's wrong is depleting their red blood cells to dangerous levels?
It is a massive issue. It's actually sparked a modern less is more movement in hospital lab ordering. We have to be incredibly strategic about how much blood we remove for testing, which ironically echoes the exact same danger of excessive blood removal that took humanity 2,000 years to figure out with humoral theory.
That is wild. So how did medicine finally transition from theoretical bloodletting to a rigorous science? And how did these ancient Greek terms become the standard language for global medicine?
The linguistic shift happened during the Renaissance and Enlightenment. European physicians desperately needed a precise, international scientific vocabulary. Everyday vernacular languages like English or French, they were too imprecise and varied from region to region.
That makes sense.
So they reached back to classical Greek and Latin to build a universal medical language from scratch. This is why we have cardio for the heart, nephro for the kidney, hepato for the liver.
But using Greek words didn't suddenly give them modern medical knowledge.
No. The actual science of hematology, as a distinct modern discipline, didn't emerge until the 19th century, driven entirely by new technology. Gabriel Andral in France used improved compound microscopes in the 1840s to physically see and count blood cells.
Okay.
Then, in the 1870s, Paul Ehrlich in Germany developed revolutionary staining techniques.
Wait, why was staining so important? Couldn't they already see the cells with the microscope?
Under a primitive microscope, blood just looks like a wash of pale, uniform dots. You can't see the details. But Ehrlich realized that if you applied specific chemical dyes, different cellular structures would absorb different chemicals based on whether they were acidic or basic.
Oh, interesting.
Yeah, suddenly this uniform fluid transformed into a vibrant pink and purple alien landscape. He revealed a hidden ecosystem of entirely different types of white blood cells that no one even knew existed.
They were finally seeing the true universe inside a single drop of blood.
Exactly. And the crowning achievement came in 1901 when Carl Landsteiner discovered the ABO blood group system. Before Landsteiner, blood transfusions were essentially a game of Russian roulette. Sometimes they saved lives, sometimes they killed patients instantly.
Because they were mixing incompatible blood types, but they didn't know blood had types yet. How did Landsteiner figure out the mechanism?
He discovered that red blood cells have specific antigens, basically molecular ID tags on their surface. If you give a patient blood with the wrong ID tags, their immune system produces antibodies that attack the foreign cells.
So the body fights the new blood.
Yes. This causes massive systemic clotting. The blood cells literally clump together and block the blood vessels. Landsteiner's discovery turned blood from a mystery fluid into a rigorous quantitative chemistry, and it actually won him the Nobel Prize.
Okay, here's where it gets really interesting. I want to take all this history and apply our linguistic splitting rules, so hemo for consonants, hemato for vowels, to decode some vital medical terms from first principles. Because I want you, listening right now, to see how powerful this is when you look at your own charts. Let's start with how we actually view blood today. If I look at blood, it seems like a single mixed substance, like a red smoothie.
Visually, it is. But clinical hematology constantly forces the distinction between the liquid and the solids. If you put a tube of that red smoothie into a centrifuge and spin it at high speeds, it separates based on density.
Right, I've seen pictures of that.
Yeah, the heavy red blood cells sink to the bottom. Above that is a thin white layer called the bucky coat, which holds your white blood cells and platelets. And floating on top is the plasma, the yellowish liquid part, which is mostly water, proteins, and hormones.
So keeping that separated image in mind, let's decode our first term. Hemoglobin. We have hemo, meaning blood, plus globin, meaning a protein. Because globin starts with a consonant, we use the short form, hemo.
Perfect. Hemoglobin is the iron-containing protein housed inside your red blood cells. Its entire job is to bind oxygen in your lungs and release it into your deep tissues. And the physical scale of this mechanism is just staggering.
How so?
Well, a single red blood cell contains roughly 270 million hemoglobin molecules.
Wow.
And each of those molecules can carry up to 4 oxygen molecules.
Over 1 billion oxygen molecules inside one tiny microscopic cell? That is mind-blowing. Yeah. And this is exactly what they are measuring when they test you for anemia, right?
Yes. A clinician reads your hemoglobin concentration off a complete blood count. Normal adult ranges are about 13.5 to 17.5 grams per deciliter in men and 12 to 15.5 in women. If that number drops, you are anemic, meaning your tissues are basically starving for oxygen.
Okay, let's move outside the cell. Hematoma. Hemato plus the suffix oma. Now, I have to stop here because this brings up a huge public misconception. When most people hear a medical word ending in oma, they immediately think of cancer, like melanoma or carcinoma.
Right.
So if a doctor says you have a hematoma, are they diagnosing you with a blood tumor?
Absolutely not. And this is a very scary misconception. The suffix oma generically means a mass or a swelling. It has only come to connote malignancy in the public mind because so many famous oma words happen to be cancers.
So hematoma is just like a mass of blood.
It is a localized collection of clotted blood outside of the blood vessels, usually caused by physical trauma to a vessel wall, basically a severe pooled bruise.
But they can still be incredibly dangerous, right?
Right.
Even if they aren't cancer.
Oh, certainly. A subdural hematoma, for instance, is a medical emergency. That occurs when blood escapes a vessel and pools beneath the dura mater, which is the tough, fibrous outer membrane protecting the brain.
And the skull is in the way.
Exactly.
Yeah.
Because the skull is a rigid bone box, that expanding blood mass has nowhere to go. It ends up violently compressing the soft brain tissue itself.
Got it. Now let's look at two terms that show how just a suffix can totally change your trip to the hospital. Hematuria versus hemoptysis.
Hematuria uses humato plus uria, meaning a urine condition. It translates to blood in the urine. Hemoptysis uses hemo plus apoptysis, which means spitting. Hemoptysis is coughing or spitting up blood from the respiratory tract.
They sound somewhat similar, and they both signal internal bleeding, but that suffix acts as a roadmap. I mean, hematuria is going to route you to a urologist, but hemoptysis sends you straight to pulmonology.
It proves that the suffix is diagnostically load-bearing. The root tells you what the substance is, but the suffix tells you where it is and what is happening to it.
Which brings us to how a suffix can sometimes imply a human emotion, which is a wild concept in science. Let's look at hemophilia. Hemo plus aphilia, which translates to love of.
Yeah, this was coined in the 1820s. It is a total linguistic fossil and honestly a highly misleading name.
Because obviously patients with hemophilia do not love blood.
Quite the opposite. They have a severe genetic deficiency in specific clotting proteins, usually factor VIII or factor IXX. Without these proteins, the body cannot form a stable blood clot, leading to excessive, prolonged, and life-threatening bleeding from minor injuries.
And it has a really intense historical legacy, right? It's often called the royal disease.
Yes, it is. Hemophilia A affects roughly 1 in 5,000 male births. Historically, Queen Victoria of the United Kingdom carried the mutation. Because European royalty intermarried so heavily, she passed the mutation through the royal houses of Spain, Germany, and most notably, Russia.
Right, she passed it down to her great-grandson, Tsarevich Alexei, the young heir to the Russian throne.
And that single genetic mutation in his blood arguably helped destabilize the entire Romanov dynasty. The family's desperate, secretive reliance on Rasputin stemmed largely from his perceived ability to calm the boy and ease his terrifying bleeding episodes.
A microscopic protein deficiency, altering the course of global empires. Incredible. Now, hemo and hemo don't live in isolation. If we go back to our centrifuged tube of blood, they have a whole neighborhood of related terms that help us expand our vocabulary even further.
The terminology neighborhood is dense but incredibly logical. Let's start with colors. Erythro means red. Combine it with erythrocyte, meaning cell, and you get erythrocyte, a red blood cell.
Now, I know these are regulated by a hormone called erythropoietin, which brings in the suffix poiosis, meaning to make. But how does that actually work mechanically?
It's a brilliant biological feedback loop. Your kidneys constantly monitor the oxygen levels in your blood. If oxygen drops, the kidneys secrete the hormone erythropoietin, or EPO. That hormone travels to your bone marrow and commands it to ramp up the production of new erythrocytes.
So the kidney is essentially the thermostat, and the bone marrow is the furnace. What about the white cells in that middle buffy coat layer?
For that, we use leuco, meaning white. Leukocyte is a white blood cell, our immune defender. And this is where we get the word leukemia.
Wait, leukemia literally translates to white blood condition.
It does. Rudolf Virchow named it in 1845. He was looking at a leukemia patient's blood under his microscope and was struck by the massive, abnormal overpopulation of white cells crowding out everything else.
Wow. What about the platelets? The clotting cells?
We use thrombo, meaning clot. That gives us thrombocyte, another word for a platelet, and thrombosis, the abnormal condition of having a clot.
Which leads us to a huge misconception about how bleeding and clotting actually work. We tend to think of bleeding and clotting as binary opposites, like a seesaw. If you're bleeding, you aren't clotting. If you're clotting, you aren't bleeding.
It's highly intuitive to think that way, but it's false. In severe conditions like DIC, disseminated intravascular coagulation, a patient experiences simultaneous massive clotting and massive bleeding.
Wait, how is that mechanically possible? If you are forming clots, how are you bleeding?
Because the clotting cascade goes rogue. Your body detects a severe trauma or infection and starts throwing tiny blood clots everywhere inside your blood vessels. But in doing so, it consumes all of your body's raw clotting materials, your platelets and your fibrin, incredibly fast. You use up the entire supply.
Oh, I see.
Yeah, so you have abnormal clots blocking vessels in one part of your body, but because the raw materials are gone, you uncontrollably bleed from everywhere else. It's not a seesaw, it's a total system crash.
Man. Which brings us to a crucial pairing of terms that sound similar but means the difference between life and death. Hemostasis versus hemolysis.
This is one of the most common decoding errors in medical terminology, and you have to get it right. Hemostasis, using the suffix stasis, literally means blood standing still. It is
Oh.
the physiological mechanical process of stopping bleeding by forming a localized clot.
So that's a good thing. You want a hemostasis when you get a paper cut.
Exactly. But hemolysis, using the suffix myemolysis, which means to break down or destroy, is the physical destruction or rupturing of red blood cells.
So if you mix up hemostasis and hemolysis, you are fundamentally misunderstanding whether the body is trying to plug a leak or if it's actively destroying its own oxygen carriers.
It's the difference between a functioning healing system and a potentially fatal physiological crisis. And this level of precise understanding is vital because the science of hematology isn't just history, it is actively evolving right now.
Yeah.
The sources raise an important question at the very cutting edge of modern medicine. How do these blood cells actually form in the bone marrow?
I've seen the charts for this. You're talking about hematopoietic stem cells, right? The master cells that create the red cells, white cells, and platelets.
Yes. And there is a major scientific debate currently raging around them. The classic model from the 1960s, the Till and McCulloch model, suggested a strict one-way hierarchical tree. You have a master stem cell that branches out, stepping down into successively more specialized committed cells until it eventually becomes a mature red or white cell.
Like a strict corporate ladder. You start at the top, and you can only move down into your specific department.
Right. But newer research suggests the system might be much more plastic and heterogeneous. Instead of a rigid ladder, these stem cells might have the flexibility to shift their identities or bypass certain steps entirely based on what the body immediately needs.
Why does that plasticity matter outside of a textbook? I mean, for a patient.
Because this debate directly impacts how we design cutting-edge CAR T cell therapies for cancer. In CAR T, we extract a patient's immune cells, genetically engineer them in a lab to hunt cancer, and put them back in the body.
Right. This is amazing technology.
It is. But if the stem cells those immune cells come from are rigid, the therapy behaves one way. But if they are highly plastic, we might be able to manipulate them in much more powerful dynamic ways, or conversely, unpredictable mutations could occur.
So what does this all mean? We've traveled from ancient Greece and the four humors, through the tragedy of George Washington to Queen Victoria's genetics, all the way to modern CAR T cell therapies. For you, listening to this, what are the real-world stakes of knowing these ancient Greek roots?
The stakes are your own health literacy. This vocabulary is the hidden infrastructure underneath enormous swaths of everyday medicine. Every single time you get a routine complete blood count, or CBC, you are fundamentally reading a hematology report. Tracking hemoglobin reveals anemia, which, according to the World Health Organization, affects a staggering quarter of the global population.
And we saw the importance of this language recently during the COVID-19 pandemic, too.
We did. Tracking coagulopathy abnormal clotting became essential for survival in COVID wards. Words like D-dimer became household terms almost overnight.
Just to clarify, D-dimer is the protein debris left over when a blood clot dissolves, right? So if your D-dimer is high, it means your body is desperately trying to break down a ton of microclots.
Precisely. Understanding that mechanism allowed doctors to anticipate severe COVID complications. Knowledge is most valuable when it's understood and applied. By learning a few ancient Greek roots and a single grammatical splitting rule, you empower yourself in a clinical setting.
Understanding hemo and hemato means understanding the exact vocabulary your doctor uses to explain your physical reality back to you. You aren't just sitting there nodding politely while they speak a foreign language. You actually have the tools to decode the message.
Exactly. You become an active participant.
Which leaves us with a final thought to mull over. We started this deep dive talking about the sheer panic of staring at a lab report that looks like a foreign language. If understanding just one 2,500-year-old linguistic fossil can demystify an entire modern hematology report, how much of the fear and anxiety we feel in a doctor's office is simply a language barrier? And could a little bit of medical etymology actually be the ultimate, untapped tool for patient self-advocacy?